Hi, I'm Marjory Charlot. I'm a medical oncologist and a health services researcher. I work at UNC Lineberger Comprehensive Cancer Center. I primarily specialize in patients who have lung cancer. Another part of my work hat is working in the hospital for patients who are either have a suspicion of cancer or for patients who have a cancer diagnosis but are hospitalized for either symptoms from the cancer or symptoms from their treatment. And the other hat that I wear is as a health services researcher, and most of my research focuses on increasing awareness and access to clinical trials among Black communities as well as communities with low income or with persistent poverty. Outside of medicine, I'm a mom and a wife. So I have two children, one in elementary school and one in middle school. Other things that I like to do, I just recently completed an aquathlon. So it was a swim run competition, which is a big deal for me just because I do not have a great relationship with swimming. I learned to swim as an adult. So it was a big accomplishment for me to be able to complete this duathlon. So that was exciting. I also love to travel. I knew from, I think, a very young age that I wanted to become a doctor. I grew up in a neighborhood of Boston called Mattapan, and I was privileged enough to have a Haitian pediatrician who had his practice in the community and actually did house visits. And the Haitian community where I grew up was pretty tight-knit and pretty close, and so it was really informative for me to be able to see someone who shared my same heritage, be a physician, be one with the community, and so I wanted to be exactly like him, and so that's how I kind of got introduced to this concept or idea of becoming a doctor. My path to becoming a doctor was definitely not straight and narrow. After I graduated from college, I ended up spending a couple of years working in different types of advocacy type of work related to education earlier in my career, and then moved on to teaching middle school students about health professional careers, and then after that got my degree in public health, and then after that public health degree went into medical school. So it was sort of like a winding path to medicine, but I knew that that's where I would end up eventually. When I completed all of my medical training, I knew that I wanted to be an oncologist, so there was no question about that. And for me, the reason for that was because I felt like it was the one field where you develop these close-knit relationships with your patients, and so that was a no-brainer. Oncology was definitely the way that I wanted to go. With respect to lung cancer, it was actually influenced by my mentor in my clinic during my training. You know, at the time when I started my training, there weren't that many options for lung cancer. You know, pretty much there was chemotherapy. But during my training, there were a lot of new therapies that were coming up on the pipeline with respect to immunotherapy, targeted therapies, and so that excitement in the field was really what drew me to wanting to be a part of this like growing field with respect to options for our patients. And so that's where my love and, you know, sort of compassion towards lung cancer grew, was just because I felt like the field was getting to a place where we had more options to offer our patients other than just chemotherapy itself. I grew up in a neighborhood of Boston called Mattapan. Mattapan is a predominantly Black community. And interestingly enough, my street and pretty much my block were folks that immigrated to Boston. I mentioned that I have a Haitian background. And so for me, my interest in terms of thinking about communities really draws from that experience, because I kind of lived in two different worlds. I had the world where I grew up in Mattapan, but always went to Catholic school, which was outside of the neighborhood that I grew up. And I was able to see kind of the dichotomy or the differences in kind of where I was in school in terms of like the affluence of the area and affluence of some of the students who attended that school, and then looked at my own neighborhood where, very rich in culture, very rich in pride, hardworking people, but didn't have the same resources that where I went to school had. And so when I became a doctor, I did all of my training at a safety net hospital. So we cared primarily for people who were underinsured or had no insurance. And so it was actually the hospital where I was born. And so for me, it was like sort of ingrained in me that we really need to think about the community. We really need to think about the circumstances that people are born in or the conditions that they live in terms for the in order for the healthcare system to work. And so that's where like my whole approach in terms of thinking about Black communities and the importance of ensuring that they have the knowledge, that they have the awareness of all the resources that are available to ensure that they are able to access the care and able to improve their outcomes, through those connections. And so I would say that that's where my whole approach in terms of thinking about the Black community, thinking about my profession as a physician, and understanding ways in which how we need to make those connections together in order for us to thrive and do better and live, healthy and well lives. I was recruited to UNC primarily to work as a thoracic oncologist, so my specialty in lung cancer, as well as develop a program that was focused around clinical trials and increasing equity in clinical trials. And so as a result of kind of my research background, my clinical background, I ended up starting the CREATE initiative, which is a program. CREATE is an acronym for Cancer Research Equity and Advocacy Through Engagement, which speaks again to the strong community focus and doing all the work that we do with our community partners in order for the healthcare system to work, in order for the treatments to get to the people that they were designed to treat, is how I ended up in North Carolina and how I've used this background with respect to patient and community engagement to improve access to clinical trials and to improve access, frankly, to cancer care and high quality cancer care. Screening in general is meant to identify or detect cancers early before they cause symptoms. But with respect to the general symptoms that I see, by the time a patient's already diagnosed with cancer, normally as in my profession as a medical oncologist, we see patients, generally speaking, after the cancer has either spread or is advanced and not in a stage where it could be cured with a surgery. Although now things have changed with cancer where we're using, chemotherapy, immunotherapy, even for earlier cancer stages. But I would say that common symptoms generally could be related to shortness of breath, coughing, particularly coughing up blood, sometimes weight loss. I would say that those are kind of the top three that I think about in terms of what patients generally describe in terms of things that they've noticed when they're diagnosed with cancer. And then if the cancer has spread, they could present with various symptoms, sometimes a headache, especially if the cancer has spread to the brain. Pain in various areas, like in the bone, in the joints. The symptoms could be a wide range of things depending on where the cancer is. Again, I think that the most important thing that I think is important to be aware of is that, cancer screening is an option, particularly for people who have had a long history of smoking. 20 pack years is what the recommendation is. Again, screening is for people who don't have symptoms of cancer, but if they do have symptoms, it's also another reason to see their doctors and to be able to get examined and evaluated for, potential cancer. Clinical trials are an opportunity to get access to new treatments that are not available currently. And so I think that, for the Black community in particular, we know that outcomes are worse when it comes to survival and when it comes to cancer mortality rates. And clinical trials provide an opportunity to get access to new drugs, which ideally will prolong life. The second is that, I think it's important for all patients, regardless of their background, to have that access, because these drugs, we don't know how they're going to affect people from, whether it's based on their, environmental conditions, whether it's based on their socioeconomic conditions or their, race. So I think it's important to be able to test these drugs in a variety of different people. And so, again, being able to have access to newer treatments and being able to understand how these treatments impact various groups is the importance of participating in clinical trials. I started the CREATE initiative at Lineberger, and one of the things that we recently were in the process of completing this research grant that I have that is building a mobile app for Black women with breast cancer to access, to see if it can help increase discussions about clinical trials with their providers. And one of our patient research partners shared her story about participating in a trial. And I would say one of the most compelling pieces of her story is that this trial led to her being, number one, cancer-free for a very long time. And secondly, she's been able to see this drug now become a standard of care for breast cancer treatment. And so I think this just goes to show that going into the trial, we don't know whether or not these drugs are going to work. But what we do know is that when you're in a clinical trial, that you're under such close follow-up, number one, which gives you even an extra layer of eyes of people who are kind of watching how you're doing while you're on a clinical trial. But then secondly, if these drugs actually prove to be better than the standard of care, these drugs end up helping people live longer. And so I think it's just, fascinating and wonderful to be able to work with someone as a research partner who's kind of been through this whole process, right, of participating in a clinical trial and seeing that her participation led to the approval of a new drug that is now being used for patients with breast cancer. And so to me, there's no better story than to be able to kind of live through the process of being in a clinical trial and to be able to see how that participation led to an approval for a drug that more women and other people with breast cancer can benefit from. Just because we know that our healthcare system and our research enterprise in this country has not been the best, particularly for our Black communities. But at the same time, I think that it's important to not only acknowledge the historical past, as well as some of the mistreatment that Black communities and Black individuals often get within the medical care system. So I think acknowledgement, number one, is at the forefront. But secondly, I think it's also important to know that there are safeguards in place with clinical trials, and it's important for us, specifically as Black individuals, to be a part of clinical trials, because again, it gives us opportunities that we would potentially not have to have access to newer drugs, and these newer drugs ultimately help us live longer. And so I think that's where, I think, number one, acknowledge the past. Number two, understand that we have a part and we have the right to have access to newer treatments and to newer interventions, and we can only access these things through clinical trials. As a Black physician and other healthcare providers who are not Black, I would say number one, we need to be one with our community. So we really need to be able to understand where our patients are coming from, understand what are their needs, partner with them, because I think if we do these separately in our silos, it doesn't help improve access to care. It doesn't help our communities thrive and live healthy lives. So I think making those connections is what's helped me, I think, in the work that I do, as well as ideally and hopefully are helping the patients that I've had the privilege to take care of over these past couple of decades as a physician.